Hey friends, Dr. Christy here, and I want to talk to you all about thyroid health today. So the medical profession, the standard Western medicine practice, and functional medicine and optimal holistic wellness perspectives tend to differ a little bit on what constitutes as a healthy thyroid. So let's talk about this for a minute. Thyroid issues, hypothyroidism specifically, is so common right now, especially in women, and then even especially Hashimoto's. Hashimoto's is the subcategory of hypothyroidism when someone has antibodies to their thyroid. So this is where your immune system is literally attacking your thyroid tissue, your thyroid hormones, making it difficult for your body to hold on to those hormones so that they can actually have a positive impact on your body. Thyroid is important for your metabolic health, regulating your temperature, your energy, weight loss, many other things in the body that are just too much to list right now in this short video. But what I want to talk to you about is when you get your blood work done, first and foremost, I highly recommend getting a full thyroid panel. Many physicians will only run your TSH. That is your thyroid stimulating hormone. First of all, TSH is not actually a thyroid marker, it's a pituitary marker. Your pituitary gland, which is in your brain, makes TSH, thyroid stimulating hormone, to tell your thyroid gland to make your thyroid hormone. So once again, TSH comes to you from your pituitary, and that's the signal that knocks really hard on the thyroid's door to say, hey, thyroid, wake up and make hormone. So when your TSH level is high, elevated, that means your brain is screaming louder at your thyroid to wake up and do more of its job more quickly, more efficiently. Got it? Therefore, the opposite's also true. If your TSH is low, that means your brain is like, whoa, thyroid, back off. We have enough. You can slow it down. You don't need to make as much. So it's opposite of what you might think. When you have a high TSH, you have hypothyroidism, generally speaking. When you have low TSH, you have hyperthyroidism. This is kind of general, but this is also what Western medicine tends to think. They look at that one number to determine the entire thyroid picture. So if your TSH is normal, they say, yep, cool, everything's working great. But what if your TSH is normal? First off, what is normal? We'll get to that in a second. But what if your TSH is normal, but your thyroid hormones themselves are low? Then that is telling us that your brain isn't getting the signal. It's weakened. Your pituitary gland is not doing its job to actually tell your thyroid, hey, we need a little bit more of this to sustain and provide this person's body the optimal level of thyroid hormone that we actually need. Once again, let's go back to those reference ranges for a second. The traditional range for TSH in standard blood work is usually anywhere between 0.4 and 5. Depending on the lab, depending on your doctor's office, there might be some variability here, but that's a pretty wide range, 0.4 to around 5. Optimal range, to me at least, is between 1 and 2, especially in women of childbearing age. Between 1 and 2 is my ideal zone. Occasionally, if we get into the 2.5 range, that should be generally okay if the full thyroid panel looks good as well. Keep this piece in mind. When we look at the rest of the full thyroid panel, what we're looking for is your total T4, your total T3, your free T3, and your free T4. The free T3 and T4, those just mean that they're not bound to protein in your blood, and so that's actually what your body can utilize, and it's actually bioavailable to you to actually have an impact on your systems and your cells. So let's back this up. Your total T4 should be over 1, optimally speaking. Your total T3 should be over, depending on what kind of reference lab you use, I'd say over 120, or if you're using a different version of the lab, but like 1.2, depending on the units. Your free T3 should be over 3, in my opinion, and free T4 should be over, I actually messed that up. Your total T4 should be in like the, I want to say 7 to 8 range. Your free T4 should be over 1. If any of those numbers are less than what I just mentioned, you would likely tend to have a functional hypothyroid condition, especially couple that with any symptoms that you're having. Low energy, low libido, hair falling out, brittle nails, you're cold, you can't regulate your body temperature, you can't regulate your metabolism or your weight. you have some pitting, you have some different types of edema in your ankles frequently, or your face itself gets a little bit more swollen. So many symptoms of thyroid constipation, even cholesterol issues can be directed at thyroid issues. So if you have some symptoms of those things and your levels are suboptimal, you have a thyroid issue. I don't care if you're outside or if you're inside rather the Western medicine ranges for TSH. That's not the end all be all. So that was number one, check your full thyroid panel. Number two, the other thing I like to add is your thyroid antibodies to see if there is an immune system component. Because when you have antibodies to your thyroid, your immune system is also engaged and attacking your thyroid tissue, which means it's not just a primary thyroid problem, it's also an immune system problem, it's a gut health problem. One other piece, when your body makes T4, your thyroid gland primarily makes T4. Now, what T4 represents is that the thyroid molecule, the thyroid hormone molecule, has 4 spots for iodine. The T3 molecule has 3 spots for iodine. Your body converts T4 into T3 in the liver and the gut. So if your liver is toxic, or if you have a leaky gut, or if you have other food sensitivities or other issues that are leading to liver and gut stress and gut health dysbiosis or things of that nature, your conversion of T4 into T3 is going to be slower and poorer quality, and you're going to have thyroid symptoms even if your T4 is normal. So some doctors' offices take things a bit deeper and they're a bit more functional, and they don't just check TSH, but they also check your free T4, which is great, because what if that's normal too? But then if we do the full thyroid panel, we see, your T4 is normal, your TSH is normal, but your T3 is low, which means you're not converting T4 into T3, which is a critical step if you're going to have good thyroid health. Last piece that I'm going to mention, this is a big video and a huge topic. I probably should have split this up into 10 videos. The other piece that's really important here is when I talked about iodine. If we go back to high school chemistry and we remember that periodic table chart, the other elements that are in that column in the periodic table that are related with iodine, we have things like fluoride and chloride and bromide, as well as iodide, right? Different forms of it. That's why they have different, either at the INE or the IDE. Your thyroid hormones, that T4 and the T3, they actually have a higher affinity for those other molecules, not iodine. Now, those things are toxic. Think about it. If you jump into a chlorinated pool, you're drinking fluorinated water, and you're eating bread with bromine in it, those are 3 toxic things that your thyroid's going to go, oh yeah, that actually has a higher affinity for it. I'm not going to get into all the chemistry because, quite frankly, I'm not a chemist and I can't remember the details as to why. I do just know that it's true, that they will grab onto those things preferentially over iodine, rendering your thyroid hormones totally useless. So, very, very important topic. This is why anyone with a thyroid issue or potential thyroid issue, I highly recommend do not drink tap water that's full of fluoride. Do not eat bread. Go completely gluten-free, because especially if you have Hashimoto's, eating gluten is like pouring gasoline on a fire. It's going to make that condition worse. And you definitely want to avoid chlorine, things of that nature that are just going to be very, very toxic, impact your liver, impact your gut, rendering your thyroid hormones more difficult to do what they're intended to do. This video had a lot of information in it, way more than I'm used to doing, but I talk to patients about thyroid health all the time. There's so much to it, and if you have more questions, drop them below. I'll maybe do a follow-up video if there's some specific questions on different thyroid pieces here. But so many people have thyroid issues now, especially women, and it's time that we take our health back. So big take homes right now is do a full thyroid panel to really get the details of what's going on in your body. Potentially, if you do have a thyroid issue, go gluten-free for a few months and see how you feel. Filter your water and just really, really, really maintain your level of health. Speak your truth. Thyroid's in the throat chakra, so that's really important to be sure that you're speaking who you are, you're being your authentic self, you're not letting things get stagnant here in this throat, and you're letting those things go. All that in a nutshell. I hope you have a fantastic day, and let me know if you have any questions. Thanks.